we're live in 5, 4, 3, 2. Even as America begins to reopen, people across city neighborhoods continue to express appreciation for the healthcare workers braving hospitals to treat COVID-19. Similar to the firefighters who sacrificed their lives during 9/11, frontline healthcare workers have become the symbolic heroes of the moment. But for many American healthcare providers, this time is unprecedented in terms of the ways in which our lives are threatened. Nurses expressed appreciation regarding the community responses, but also felt a lot of stigma as potential disease carriers. The public kept saying, "Oh, nurses are heroes, doctors are heroes, they're doing so much for us." Yeah, you're out in scrubs, and they're like, "They're contaminated, get them away. They're infectious." We keep indoors. When we dare to venture out, we are cautious. Our neighbors smile, but in their eyes there is reserve and suspicion. They keep their distance as we do ours, in mute accord. As we face the tail end of the COVID-19 crisis, there is still much work to be done. As we see the emergence of a new strain, new fears about long-term effects, we all need to take a moment and think about the healthcare workers, those who have spent countless hours in intense PPE trying to ease the suffering of COVID-19 patients. These people have put themselves at great personal risk to help us, and it's time that we appreciate them properly, because they're not infectious. They're human beings, and they're just as scared as we all should be. Articles from the Washington Post, the New York Times, and the Intelligencer's Diary of a Hospital comes a program dedicated to those healthcare workers who risk their lives every day for us. From the moment he wakes up, Peter Shearer, the chief medical officer at Mount Sinai Hospital in Brooklyn, spends his day thinking about coronavirus. Like every other hospital in the city, Shearer's ER and ICU are now inundated with COVID-positive patients. Shearer knows this is only the beginning, and so he and his Mount Sinai colleagues have agreed to keep us updated on life inside the hospital. This is the first dispatch. The number of very sick COVID patients coming in is scary. We have 220 beds. We've planned for a surge of up to 240 and 260, and they are sick. The patients are so sick. We probably now have about 5 COVID deaths a day or more. It was a really sudden ramp up with increasing numbers of patients. They were sick and getting admitted, and the beds were filling up, and the patients were just crashing on the floor. Let me pull up my mortality rate from yesterday. I haven't seen it yet. So, 10 people died yesterday. So much for that 5 a day. I've cried in stairwells and hallways. Life is fragile, and it could be anybody. It could be any of us. There are days I'm convinced I'm gonna get it and I'm gonna die, but I think that's more emotional than scientific. We started putting bodies in the morgue truck last week, and it's been used a lot. I think there's around 40 bodies in there now. We've outfitted it with shelves because you have to keep track of people. You have to make sure that the right family gets the right body back. Huh? I have a COVID positive 41-year-old patient who just died about 5 minutes ago. I just got the message. I don't know how long I can keep doing this. In my mind, I'm gonna do it. I'm gonna do it until it's done. But it's gonna be real hard to come back to work after this is all over. Much of our fear is unspoken, for there is at last the weight of custom, the tender of rote consolation. We endure thoughts of demise and measure the distance of death. Death, too, wears a mask. Mark Ayub remembers the woman in her 50s who came into the emergency room. Ayub, a resident at Elmhurst Hospital in Queens, tried to reach her family, and when he connected with her daughter, he had only bad news. As he stood in his spacesuit of protective gear, holding his phone out in front of the woman's face so her daughter might see her one last time, Ayub was indignant that this is what death had become. He could not help but overhear, Mommy, please come back. Please. Alex Incompang is an ICU nurse based in Texas who came to New York to volunteer during the COVID crisis. As an Army veteran, Incompang was used to dealing with trauma, but she had never experienced anything quite like this. Her dispatch. There was one really bad day, April 12th. We were trying to keep this one patient alive who'd been coding all night, and then she was coding. Well, we made it a short one, not to be cruel. But then a next door neighbor coded, and then I run in and I take over chest compressions. And in the hospital, they put an iPad on a tripod so that the patients' families can FaceTime them. Finally, they call the code. Time of death. When I ran into the room, I accidentally hit the iPad so it fell facing the wall. I walk back around and I see the iPad and I realize that the family's still on there. I'm like, shit. Shit, it's still on. The doctor sees it, and then he goes over and gives the bad news. And I just hear him screaming, wailing over FaceTime. When I go into these rooms, I'm thinking to myself, am I the last face that these patients are seeing? And I'm sorry, it's me. I found myself asking God to forgive me. I shouldn't be the last face they see. The worst night I had was in the emergency room. I intubated one woman, and I look to my left, and I see this girl. She's curled up, and I can hear her breathing. Hey, she's next. I go to the head of the bed, and I'm getting ready. And I was so taken aback that she had these beautiful blue eyes. And I'm thinking to myself, she's looking at me, and I'm looking at her, and then this is it. Her eyes should have been looking at her husband or kids. I intubated her, and she didn't make it. I don't want to play God. I thought my job as a physician was to do no harm. We can determine who we are in our essential nature and who we can be. We are committed to this end for our own sake and for the sake of those who will come after us. There is a better future, and we can secure it. Let us take up the task, and let us be worthy of our best destiny.